You just Googled best functional medicine doctor in Baltimore, which tells me you're not looking for another prescription to manage the same problem. You're not looking for someone to tell you everything looks normal when it clearly doesn't. You want real answers. This video is going to help you figure out who can actually give them to you. Most people pick a doctor the same way they pick a restaurant. Stars on Google, distance from their house, price if they're paying out of pocket. And I get it. Those filters are easy, but here's the problem. A 5-star rating tells you the staff was friendly. It doesn't tell you whether the doctor actually solved anything. Proximity tells you where to park. It doesn't tell you whether the practitioner has the training to address what is actually happening in your body. Before you book with anyone, including me, you should know what to look for. What I'm about to give you are the 4 criteria I'd use if I were the patient sitting in your chair. Criteria 1, diagnostic depth. They run tests that go beyond what your last doctor ordered. Standard labs were built to catch disease. They were not built to help someone who is functional, but nowhere near thriving. If you've ever been told everything looks normal and left the appointment feeling something was still wrong, you were probably right. The answer just wasn't in those tests. Ask any doctor you're evaluating, what do you look at that a standard panel would miss? If they can name specific markers like hsCRP for inflammation, fasting insulin, a full hormone panel, you're dealing with someone who's looking at the full picture. If they pause or redirect, they're working from the same incomplete map everyone else has already handed you. Criteria number 2, root cause thinking. They're looking for a why, not just a what. A diagnosis names what is happening. Root cause thinking explains why it keeps happening. These are completely different conversations, and most practitioners only have one of them. In the first appointment, does the doctor ask you about your sleep, your stress, your diet, your hormone history, and your lab results from years ago? Or do they focus only on one problem that you walked in with today? The scope of the first conversation is always a preview of the scope of the care you'll receive. Criteria number 3, integration across both types of medicine. They know when to use conventional medicine, when to use functional medicine, and when not to use either. Conventional medicine is excellent at acute intervention. Functional medicine is excellent at optimization and root cause analysis. The practitioners who can get the best results are the ones who know which tool belongs in which situation and who aren't locked into one lane because of ideology or training. Ask directly, are there situations where you would refer out for a conventional specialist or use a conventional treatment, even in a functional medicine practice? If the answer is yes with specific example, that's a thoughtful clinician. If they say they handle everything themselves, pay attention to that, because that may be concerning. Criteria number 4, honest selectivity. They tell you what they can help with and who they cannot. A practitioner who accepts every patient is not being generous. They're not being selective. Selectivity is how you know someone is paying attention to whether their approach is actually a good fit for your situation. Listen for the language like, this approach works best for patients who, or I would not be the right fit for someone who. That kind of framing tells you they're thinking about outcomes for you, not just filling an appointment slot. I had a patient, an executive in his early 50s, who came to me after seeing multiple doctors over several years. He was overweight, exhausted, dealing with chronic pain, and had been told by every practitioner he'd seen that his labs were normal. When we ran a comprehensive workup, we found elevated inflammatory markers, a hormone panel that was technically in range but nowhere near optimal, and nutritional gaps that were pulling his energy down from him every single day. We addressed all of it together, not one thing at a time. 6 months later, he lost 40 pounds, increased strength by about 30%, and told me he felt like he was 30 years old again. What's changed wasn't one treatment. It was looking at the whole picture at once. If you're in the Baltimore, Maryland area and you want to know whether this kind of approach is a fit for your situation, the link to a consultation is in the description. No pressure, just a real conversation.